You're 72 years old. You feel healthy. Maybe you get a little short of breath when walking uphill, but otherwise life feels fine. Your doctor suggests a routine screening test. Nothing unusual, just something they've been recommending for years. You agree, after all, what harm could it do? But then the test result comes back abnormal. Suddenly you're sitting in a cold hospital room while the doctor says, "We need to look deeper." More tests are ordered. A biopsy is scheduled. Before you know it, you're recovering from a painful procedure, wondering how things escalated so quickly. And here's the shocking part. Weeks later, you find out the original result wasn't dangerous at all. The abnormality was harmless, just part of the natural aging process. This isn't just a hypothetical story. It's happening every single day in America. In fact, according to the Mayo Clinic, risk up to 40% of screenings in older adults result in false positives. That means almost half the time, tests are finding problems that either don't exist or don't matter. Harvard Health reports that seniors are also the group most likely to be overtreated, given medications, surgeries, or therapies for conditions that might never have caused harm. Why does this matter? Because after 70, the risks of these unnecessary tests and treatments become much higher. A younger person might bounce back quickly from a biopsy or surgery, but for someone in their 70s, the recovery is slower, the side effects are harsher, and the chance of complications is much greater. Today, we're going to uncover a truth that many people don't realize. Not all checkups are good for you once you cross a certain age dot. Some can actually do more harm than good. In this video, we'll explore why the body responds differently after 70, the hidden dangers of overdiagnosis and overtreatment, the specific tests that become risky past this age, the screenings you should still continue, and finally, a simple framework to help you and your doctor make safer, smarter choices. This is not about avoiding doctors. It's about choosing wisely. Because the truth is, some checkups can protect you, while others might put you at unnecessary risk. So if you or your loved ones are over 70, stick with me until the end of this video. It could mean the difference between living with peace of mind or living with unnecessary fear, procedures, and medical bills. Let's begin. Now, before we look at specific checkups, let's first understand the body itself. Why is it that after 70, something as routine as a scan, a biopsy, or even the simple lab work can carry bigger risks than they did earlier in life? Now that we've seen how the aging body changes, let's talk about one of the biggest dangers hidden in regular checkups after 70, overdiagnosis and overtreatment. At first glance, the terms sound confusing, but the idea is simple. Overdiagnosis happens when a test finds something that technically looks abnormal, but would never cause symptoms or shorten a person's life. These are often tiny, slow-growing issues that the body would quietly live with for decades. The problem is, once a doctor finds it, it's almost impossible to unsee it. Then comes overtreatment. This is what happens after overdiagnosis. Doctors, trying to be thorough, recommend more tests, medications, or even surgery, even when the treatment itself may do more harm than the condition. Let me give you a real-world example. Harvard Health published a report on prostate cancer screenings in seniors. They found that up to 60% of men who underwent biopsies after a PSA test had cancers so slow-growing they would never have caused harm. Yet many of these men ended up receiving aggressive treatments like surgery or radiation treatments that came with side effects like urinary problems, infections, or even erectile dysfunction. And it's not just prostate cancer. Similar trends have been seen in breast cancer screenings, thyroid nodules, and lung CT scans. The Cleveland Clinic warns that older adults are at particular risk because their bodies are less resilient. A younger person might tolerate an unnecessary biopsy or surgery better. But for a senior, that same procedure can lead to complications, infections, and a long recovery that impacts independence. But here's something people often forget: the emotional toll. Imagine being told, "We found something suspicious," even if later it turns out to be harmless. The stress, the anxiety, and the endless waiting for test results can deeply affect quality of life. Many seniors report that after a false alarm, They no longer feel healthy. They live with a constant fear that something is wrong. And then there's the financial toll. The U.S. healthcare system is expensive, and unnecessary tests or treatments can cost thousands of dollars. For seniors on fixed incomes or retirement savings, this can be devastating. A false positive mammogram alone can cost hundreds of dollars in follow-ups, while a biopsy or surgical procedure can run into the thousands. Doctors themselves acknowledge this issue. In fact, the Cleveland Clinic has a saying, sometimes the treatment is riskier than the disease itself. So why does overtreatment happen? Partly because of the way modern medicine is structured. Doctors don't want to miss something, and patients feel safer doing more rather than less. But in older adults, more testing doesn't always mean better health. Sometimes it just means more complications, stress, and medical bills. So now you might be wondering which specific checkups are most likely to fall into this trap after age 70. Let's go one by one because knowing the risks could save you from unnecessary pain. All right, now it's time to get very practical. Which checkups exactly should you be cautious about once you cross 70? Let's break them down one by one. Prostate cancer screening, PSA test. For men, the PSA blood test is one of the most common screenings. At first, it sounds harmless, just a simple blood draw. But here's the problem. The PSA level can rise for many reasons besides cancer, like a minor infection or even physical activity. The American Urological Association and the USPSTF both recommend against routine PSA screening after 70. Why? Because the test often leads to unnecessary biopsies. And biopsies aren't simple. They involve inserting needles into the prostate, which carries a risk of bleeding, infection, and even hospitalization. A Harvard Health study found that most cancers detected this way in seniors grow so slowly they would never cause symptoms. Yet thousands of men end up going through surgery or radiation, which can cause incontinence or impotence. In other words, the cure can be worse than the disease. Breast cancer screening. For women, mammograms have saved many lives. But after a certain age, the picture changes. The USPSTF says the benefits of mammograms after risk age 74 are unclear. Why? Because older women often develop slow-growing tumors that never spread. Yet, once a suspicious lump is found, the cascade begins. More scans, biopsies, and often surgery or radiation. The emotional toll can be overwhelming. A report from JAMA Internal Medicine found that thousands of older women undergo unnecessary breast cancer treatment each year, often with little to no benefit. Colorectal cancer screening is important in midlife, but after 70-75, the risks climb sharply. A colonoscopy requires sedation, fasting, and bowel prep, all of which can be stressful for seniors. More importantly, the risk of complications like colon perforation or internal bleeding rises dramatically with age. The American College of Gastroenterology suggests most people should stop colon cancer screening after age 75. For someone frail or with multiple health conditions, the risks often outweigh the benefits. Tests and routine ECGs. It sounds smart to check your heart, but many seniors show small irregularities that are completely harmless. The Cleveland Clinic notes that these findings often lead to unnecessary stents or bypass surgeries, procedures that carry major risks in older adults. For example, one study found that up to one-third of seniors undergoing stents for mild blockages didn't actually need them. Yet once the test shows an abnormality, doctors feel pressure to act. Tests, DEXA scans. Bone health is important, but over-testing is a growing problem. Many seniors are diagnosed with osteopenia, mild bone thinning, and put on strong medications. Drugs like bisphosphonates can cause serious side effects, including jawbone damage and unusual fractures. Doctors now advise treat fractures in symptoms, not just numbers. These are often marketed as peace-of-mind packages, but in reality they cause more fear. According to the Mayo Clinic, over 60% of seniors who get full-body scans show incidental findings, harmless spots or scars that trigger further invasive testing. And CT scans also expose patients to high levels of radiation, which itself carries risks. So does this mean you should stop all checkups after 70? Not at all. Some screenings are more valuable than ever. The secret is knowing which ones. By now, you might be thinking, if so many tests are risky, should seniors just stop going for checkups altogether? The answer is a clear no. The real secret after 70 isn't avoiding medical care. It's focusing on the right checkups, the ones that can truly improve quality of life and prevent major health problems. Let's go through the most important ones. 1. Blood pressure monitoring. High blood pressure is called the risk silent killer for a reason. It usually has no symptoms, but it's the leading cause of strokes and heart failure in older adults. The CDC reports that nearly 2/3 of Americans over 60 have high blood pressure, and many don't even know it. Unlike risky screenings, blood pressure checks are simple, safe, and effective. Managing it with lifestyle changes or medication can dramatically reduce the risk of stroke, heart attack, and kidney damage. In fact, studies show that controlling blood pressure in seniors reduces stroke risk 40% or more. 2. Blood sugar, diabetes testing. Now, blood sugar tests can be tricky. Overtesting can lead to unnecessary medications. But if a senior shows symptoms like unexplained weight loss, frequent urination, or constant thirst, an HbA1c test can be life-saving. Diabetes is extremely common in older adults, and when left untreated, it can lead to vision loss, kidney disease, or nerve damage. But here's the key. Treatment should be gentle and individualized. Experts at Harvard Medical School recommend looser blood sugar targets for seniors to avoid the risks of low blood sugar, which can cause falls and hospitalizations. 3. Vaccinations. One of the most effective, yet often overlooked, forms of preventive care is vaccines. The immune system weakens with age, which makes infections more dangerous. Flu shots reduce the risk of severe influenza, which kills thousands of seniors each year. Pneumonia vaccines prevent lung infections that often lead to hospitalization. Shingles vaccines protect against painful rashes that can last months or even years. The CDC strongly recommends all three for adults over 65, and studies show they can significantly lower hospitalization rates. 4. Vision and hearing test. It may not sound as dramatic as a cancer screening, but eyesight and hearing are directly linked to independence. Poor vision increases fall risk, and untreated hearing loss is associated with faster cognitive decline. Johns Hopkins University found that seniors with untreated hearing loss are up to 5 times more likely to develop dementia. Getting glasses, cataract surgery, or hearing aids can dramatically improve quality of life. 5. Risk assessments. Here's something surprising. One of the greatest health risks for seniors isn't cancer or heart disease. It's falling. According to the CDC, 1 in 4 seniors experiences a fall every year. And many of those falls lead to fractures, hospital stays, or long-term loss of independence. Simple balance tests, home safety evaluations, and mobility exercises can make a huge difference. Doctors can recommend physical therapy or small lifestyle changes to keep seniors steady on their feet. So while some screenings may be risky, others are absolutely vital. The key is choosing wisely, but that raises an important question. How do you decide which checkups are right for you and which ones are worth skipping? That's where a simple decision framework can help. By now you've seen that some checkups can protect your health, while others may actually put it at risk. But here's the big question. How do you decide which ones to say yes to and which ones to avoid? The truth is, there isn't a single answer for everyone. What's risky for one person may be necessary for another, depending on their overall health, lifestyle, and family history. But there is a simple framework, that can guide you through these decisions. Whenever a doctor recommends a test, ask these 3 powerful questions. Question 1. Will this test change my treatment or outcome? If the answer is no or not really, then it may not be worth doing. For example, imagine a heart stress test shows a mild blockage. But if you're not a candidate for surgery because of age or health, then the test result won't actually change anything, except causing worry. Question 2, what are the risks of the test itself? Every test has risks. A colonoscopy can cause bleeding. A CT scan exposes you to radiation. A biopsy may lead to infection. Weighing those risks against the possible benefits is essential. If the risks outweigh the potential gain, it may be smarter to skip it. Question 3, what happens if I do nothing right now? This is the question most people never think to ask. Often the answer is nothing serious. For slow-growing conditions in older adults, monitoring may be safer than immediate action. Sometimes simply watching carefully is the best medicine. Doctors today encourage what's called shared decision-making. Instead of the doctor making all the choices, you and your family sit together with your physician, review the pros and cons, and make the decision as a team. This approach respects your values. Some seniors prioritize living longer at any cost. Others care more about avoiding procedures and focusing on comfort. Neither choice is wrong, but it's important that the medical care matches the person's goals. One of the smartest steps is to bring a trusted family member or friend to appointments. Not only do they help ask the right questions, but they also act as a second pair of ears. Medical conversations can be overwhelming, especially when you're hearing about risks, test results, or complicated terminology. Take the case of Mrs. Adams, a 76-year-old woman who was offered a colonoscopy. She asked her doctor the 3 questions. Would the test change her treatment? Probably not, since she had no symptoms and was otherwise healthy. What were the risks? Higher due to her age. What if she did nothing? Likely nothing would change. Together, she and her doctor decided to skip the colonoscopy and focus instead on blood pressure, mobility, and vaccinations. This kind of thoughtful decision-making not only avoids unnecessary risks, it also gives peace of mind. Now let's wrap everything up with the bigger picture. What's the real secret to staying healthy after 70, and how can you protect both your body and your independence? We've covered a lot in this video. Let's take a moment to step back and look at the big picture. For decades, the message has been simple. The more checkups, the better. And for people in their 40s, 50s, and even early 60s, that advice makes sense. Early detection saves lives. Screenings can stop disease before it gets out of control. But after age 70, the story changes. The body is different. Healing is slower, the immune system is weaker, and everyday checkups can open the door to unnecessary risks. We've seen how common screenings like PSA tests, mammograms, colonoscopies, heart stress tests, bone scans, and even full-body imaging can sometimes do more harm than good at this stage of life. Not because doctors want to hurt us, but because medicine itself is designed to look for problems. And once a problem is found, even if it's harmless, the cycle of more tests and more treatments begins. This is the trap of overdiagnosis and overtreatment, and it's one of the biggest hidden threats for seniors in the modern healthcare system. But here's the good news. You're not powerless. In fact, the smartest seniors and their families are the ones who know how to ask the right questions and focus on the right priorities. We talked about these checkups that still matter: blood pressure monitoring, diabetes testing when symptoms are present, vaccines, vision and hearing care, and fall risk assessments. These are the areas where medical science shows real, measurable benefits for people over 70. These are the things that keep you independent, safe, and healthy. And we explored the decision framework. 1, will this test change my treatment? 2, what are the risks of the test itself? 3, what happens if I do nothing right now? If you can remember those 3 questions, you'll already be ahead of most people sitting in a doctor's office. Now let me leave you with this thought. Living longer is a gift, but living longer with quality, with independence, clarity, and peace of mind, that's the real goal. Sometimes that means saying yes to a checkup, and sometimes it means saying no. Medicine is powerful, but wisdom is knowing when not to use it. If this video helped you see things in a new light, share it with your parents, your grandparents, or anyone you love who is over 70. It could save them from unnecessary stress, painful procedures, and thousands of dollars in medical bills. And if you want more evidence-based, easy to understand health insights that most people never talk about, hit that subscribe button right now. Because on this channel, we don't just chase health myths, we uncover the truth. Remember, after 70, the best checkup is not the one that finds the most problems. It's the one that truly helps you live better.